He was unconscious. He went into respiratory arrest. His blood pressure dropped. He was septic. He had cardiovascular collapse. He had to be intubated. He had to be sedated. He could not communicate. At that level of illness, kidneys start failing, liver starts failing, the lungs are failing. You don't know the status of the brain.
When I walked in, he was just totally stunned. He wasn't the same person anymore. He's got bags hanging everywhere all over the walls, dialysis running 24 hours a day.
It was very frightening for the whole family.
He had about a 5% chance of survival.
Everyone was just holding on, hoping for some improvement. It became evident pretty quickly that he was not only septic, but he had involvement with infection of his entire spine.
That's when they found, a large pus sac in his lower back on the spinal column, and then on the upper neck in the spinal column too, and up in his shoulder. And these pus sacs were putting pressure on his spinal column, which were causing damage to his legs and to his arms and nerve systems and everything else throughout his body.
You'll see somebody who's that ill, a spine that looks like it's infected from the head all the way to the tailbone, and you have someone who cannot breathe. And as time went on, and it was evident that he wasn't waking up very quickly, it became more and more concern whether he was going to even wake up.
Focus was keeping him alive.
And then we'd just take it minute by minute.
Hour by hour. And then it was day by day. And, he'd fight.
Every day that we buy is a day we have closer to getting him back. He's had at least 16, 20 procedures over a period of that month, including the surgeries on his neck and his back.
That required several operations. There was very high risk.
And so we'd ask, well, what if we don't get this done now? What if we wait another day? And the answer was always, he's going to die.
His family, his working associates, they set up a vigilance that I've never seen. They never, ever left his side.
And Gail would sit there and talk to him and tell him she needs him better, that the house is empty without him in it.
Dave Jr. and Mary alternated and were there nonstop.
It was 24/7 that they were there. They made sure their father was never alone.
Margaret and the people from the office. The list is just so many you can't even mention. And we'd sneak his guests back in there because we wanted them to hold his hand and tell him, hey, you're needed and we need you back here.
It was almost like a Liniger compound. When you walk into the waiting room, there would be 15 chairs all around each other. What your job was to keep everybody else's spirits up.
Dave was in the process of trying to get weaned off the respirator. He wasn't getting enough oxygen. His oxygen dropped. His heart went to a rapid rhythm disturbance and he lost consciousness. They called the code blue. We started resuscitating him with chest compressions and a bag on his tube, which was still in his trachea. And he came back very quickly. There was minimal amount of time that he wasn't getting circulation.
The reality hit us that he's not even close to getting out of the woods yet.
Dave is a fighter. He always has been.
He's a tough son of a bitch.
Even with the tube in on a ventilator, Dave's eyes were open, he was staring, he was looking, he was communicating, and I think it was his communication with his family and with his doctors that made an amazing difference in his recovery, because he never, ever let go. You could always see it in his eyes that he wasn't going to give up. The longer you're in bed, the more likely you are never to get out of bed. Laying flat on his back, he developed terrible breakdown of his skin. I've seen many, if not most patients, never recover from that.
This is a hole in his back that goes to his spinal column. You can stick your hand in.
The skin breakdown and the ulcerations that occur from pressure takes major surgical and personal sacrifice to recover, because you can never leave pressure on that area.
And this is after he's starting to regain consciousness and awareness, throughout the day of his treatment and what's going on. He could make decisions. We're getting him to watch the news, and everybody's trying to hold conversations with him, and he's very hard to understand because he was intubated for so long, his voice box isn't working. So we're just trying to make sure, we can keep him going. But once they told him 35 days flat on your back, no movement, it was just a punch in the stomach.
He could have ended up paralyzed and permanently disabled just from an ulceration that would never heal.
We're looking at the scope of his recovery being huge.
David could barely move any extremity without pain. The movement in his feet and his arms, incredibly painful, to the point where people were wondering, would he ever be able to move? The more drugs he got, the worse he felt. So to get himself where he could use his muscles and strengthen himself, he insisted on stopping the pain medications.
That's about when he started coming out of it, and he became aware. And that's when he started doing what Dad does, and that is the great Dave Liniger starts making goals.
He would put up his goals, leaving the hospital on June 29th.
He just always pushed himself.
Today I'm going to move that leg 1 inch. He would just move the leg. He'd move his arm just till the point where it hurt him so badly, and then he'd go a little bit further.
If they would say, Dave, do 10 of this, he would do 20 of it.
They put him into a pool to take up the buoyancy of his weight and minimize how much he had to touch the ground. They could barely let his feet touch the ground without him experiencing pain, let alone stand. And he would tell me, I got 10% of my weight today, and I was able to handle it. And I thought, that's pretty amazing that he could even know that. And he had his mind set that he was going to get all his weight on his feet. Every day he insisted, every day, more weight, more weight, more weight.
Had his air hose in and his turtle shell on, and he was pedaling away, and just, you could tell he was just in huge pain, wincing away, and there was nobody else in there. And some lady walked in and said, are they closed today down here? And Dad's like, they're open every day. And he says, and I'm going to be here every day. He's got the hardest work ethic of anybody you've ever seen.
Every single one of Dave's challenges he met and overcame. And every single one of them posed a threat to his life. Even the rehabilitation, because every one of those steps involved major sacrifices on his part, of times where his spine could have collapsed, times where his muscle strength would just not have been able to support him, and he kept going and going.
It's all him. It is all him, all heart, and it's all determination.
I don't believe I've ever seen anyone flat on their back for that long and survive, let alone walk. I saw him in pain, I saw him struggling, and I never ever saw him give up, ever.
Dave never, ever, ever, ever quits. I knew that because there were so many times he could have in the early days of Remix that most sane people would.
I mean, Dave has said there from day one, you just don't give up.
Dave's a fighter.
He should not be here today, by statistical records. But then again, nothing replaces heart.
It certainly defies logic, it defies medical prognosis, it defies medical science. I want to thank Dave for giving me insight into what somebody can actually do with their mind. Dave had a goal, and he never ever lost sight of it.
You have to look at what's inside of him. He has a lion inside of him. He's got a lion heart. He has a heart, and so does his company.
Dave's passion, his drive, and his focus is the exact same as it was 40 years ago when he started the company. And That consistency is so important to who we are and how our company grows.
And that's why RE/MAX is so successful today, is because of him and because of Gail. What they've overcome in their lives, people look at, I can overcome anything. He's a life lesson in himself.